This is a technique having the patient do the active motion in order to increase ankle dorsiflexion. So the idea is to take a mobilizing strap. I'll show on the skeleton here first. We're going to take the strap and we're going to put it around the talus. And I'm going to hold the talus relatively posterior, having the strap below the malleoli. Keep the talus posterior, then the patient is going to actively dorsiflex. So I'm giving a relative posterior glide of the talus as the tibia comes relatively forward. Patient's in control of how far they're moving, what symptoms they're having. So I like to have the patient's foot on a small step at the very back edge. That way it gives me space for the strap to pull down and back and not get cut off by the floor. So positioning the strap is important. I want to make sure that I'm on her talus and not on her malleoli, so I'll make sure I'm below the malleoli. I'm just going to fold this strap over a little bit for a smaller area. Is that tolerable in the front of your ankle?
Yes.
If this was pinching, what I could do is add a small towel just to pat it a little bit, but she says it's okay. You can see it better this way. So again, I'll make sure the strap is below the malleoli on both lateral and medial side. Put a little bit of weight through your foot. I maintain pull, which is tolerable, and then the patient can dorsiflex into the barrier and back out of it. Nice technique. I tend to do the talus only part where I'm the practitioner holding the talus backwards. You could also have a second practitioner positioned in the front, pulling the tibia relatively forward with dorsiflexion as well. Or I could actually take my hand, back off again, and as she's dorsiflexing, I can give her an anterior glide of her tibia and a relatively posterior glide of her talus. Nice technique.